Robert Shea with Grant Thornton. Delighted to be with former Maryland Governor, former Baltimore Mayor Martin O'Malley. Governor, you certainly led your jurisdictions during crises. What can you tell us about what those leaders are going through today in the middle of a global pandemic?
Right. I was actually mayor, Robert, when 9/11 happened, and after that point, I threw myself into homeland security and preparedness with the focus that comes from realizing that you're not, if not in the bullseye, you're certainly near the bullseye of our nation's capital. So this is what I believe I've learned about crisis management and leadership in a crisis, and the discipline, the practice. Perhaps it's an art, perhaps it's a science of actually getting ahead of a crisis. In any big event, whether it's a giant fire or a hurricane or a pandemic, there are really only four questions a leader has to answer for his or her people. And those questions are: what's happened? What do you actually know about it? What are you doing about it? And fourth, what should me and my family be doing about it? Or in the case of within government, what should me and my department, agency, staff be doing about it? Each of those questions is actually a question of where. Not only where in terms of where the event is happening on the map. We've all seen maps in the last few weeks of this quarantine with the outbreak on it, but also where in terms of the time-space continuum. There are three practices, if you will, that I've seen effective leaders use in this crisis, some using it much more effectively than others. I've been hugely impressed with the daily press briefings from Governor Cuomo. So here are the three practices, to my view anyway. Really effective leaders to get ahead of a crisis, create a unified command. They use the map and the measures to create a compelling scoreboard so everyone can see whether the actions we're taking are getting us a better result or whether things are getting worse. And third, effective leaders create a battle rhythm, a very relentless cadence of accountability and collaboration. Not just meetings, not just bringing people together with meetings, but bringing them together behind the unified command, in the case of a pandemic, the health professionals, and then taking the actions against short deadlines every 3 hours in order to get inside the turning radius of the problem. So that's what I believe I've learned about crisis management.